Hi, I'm Matt Willis, Public Health Officer from Marin County with the COVID-19 message for August 20th. I'd like to talk about school reopenings and face covering. This is an important time to get this right because we're seeing elevated transmission of COVID-19 in our community due to the Delta variant while our schools are reopening. And at the same time, the mask conversation is getting more politicized every day, which could distract us from the science and common sense policies. I'd like to ground this in a real-life scenario. This week, a lot of our students are coming back for their first day of school, including two of my kids. In at least two of our schools, the school community received the unwelcome news that someone infected with COVID-19 was present on campus that first day. This provides a few good lessons regarding face covering. First, it's not a surprise that someone infected in the community was in the school, with 40 to 50 cases being reported daily in our community. Obviously, these cases were not infected at school because school hadn't been in session. We have to anticipate that there will be, on occasion, students and staff bringing the virus onto campus unknowingly, given the current transmission rates in the community. Last year, we found the majority of cases among school students and staff were not infected at school. So the question is, how do we create conditions at the school that prevent spread? And that's where masks fit in. When I hear there's been a case on campus, my first question is, was that student masked? And were those around them masked? And here's why. The best way to illustrate this is to walk through a scenario. Remember that when someone is infected with COVID-19, it's almost always the respiratory transmission from one person to another based on being close enough for long enough. So imagine I'm infected with COVID-19. I may not know it because I may have mild symptoms or no symptoms. And let's say my routine is that I'm covering my face on campus when I'm in school. In that case, the people I come into contact with are 70% less likely to be infected than if I was not covering my face. That's called source control, because I'm the source of the virus in that setting. Now, what about those around me who I expose? It turns out their masks also protect them against being infected by me. Their mask reduces their risk by another 20 or so percent. This is why the CDC is now talking about how wearing masks protect yourself from infection. What we call mask-on-mask exposures, where both parties are covering their faces, are the lowest risk because the protection is combined. And that's why universal masking on campus helps ensure that our schools will remain open. This concept is key to our response to in-school exposures, like those that occurred yesterday. This year, there's something new from the CDC that's being applied across the state and in Marin. It's called modified quarantine. And here's how it works. Basically, if both students, the infected person and the exposed person, are wearing masks when the contact occurs, the exposed person doesn't necessarily need to quarantine. The masks have reduced the risk enough to allow that student to stay in school. But if either of them is not wearing a mask, the person who was exposed has to stay home for at least 5 days. Parents of students who are unmasked and exposed should be aware that their child may need to stay home from school and their masked classmates would not. Vaccine status is another factor in allowing people to stay in school who have been exposed. But we're focusing on masks here. And remember, no one under 12 can be vaccinated, which includes our entire elementary school population. Hopefully, it's now clear why exposures in schools where significant numbers of children are not covering their faces are far more disruptive to the school environment, because more students would be required to stay home and more are likely to be infected. My biggest concern as we reopen schools is a simple one. I'm concerned that not wearing masks in school will lead to preventable school closures. Throughout our reopening, masks have allowed us to open more sectors and have more freedom to interact. All along the way in our pandemic response, it's been about balancing potential harms. We all want to see our children mask-free, especially after more than a year of this. We know that seeing each other's faces is part of healthy and normal social development. But these are not normal times. And we see higher value here in universal masking, at least for now, with the Delta variant, to protect schools from having to revert to distance learning and protect students and staff from COVID-19 disease. Thank you for doing your part.